wherever he went, he fired the masses up because he was also an extremely good public speaker. It was a totally different luncheon on the platform than luncheon at press conferences. Dr. Luncheon really joined the struggle in the 1980s. At the time when he joined the party in the early 1980s, I was working for the party in Czechoslovakia at that time. So I didn't meet him immediately as he joined the party. I met him when I came back. I used to meet him, of course, when I came back intermittently. But I began to know him very well when I came back in 1988. He was already an established member of the party. In that very year, he was elected to the leadership of the party. And we worked very closely then, because then we had to work. In that period was a very intense period when we were struggling to have free and fair elections and to bring back democracy in our country. And he was very much a part of that difficult struggle. He was a member of well, at that time he was working in the public hospital as a doctor. He really gave an example for other doctors, particularly some of the doctors of today when you hear how much money they charge people. Luncheon worked only for his salary at the public hospital. And he used to go to work with his bicycle. I don't think that Dr. Luncheon ever bought a car for himself. Because he was up to 1992, he was going to work on a bicycle when he was at the public hospital. He lived off his salary. And he had a tremendous relationship with his patient. He was a fantastic doctor. And I believe that goes to his own makeup as a person, his characteristic. He always seems to be a person who wants to serve, give public service, serve working people, serve the People's Progressive Party, because through the People's Progressive Party he saw that this is a party of the working class. He was in the trade union movement in the PSU, and he led a fight to try to make the PSU into a proper union, together with Harry Naubat and others. They worked hard in the union to improve the conditions of the workers. And eventually in 1992, when we won the elections, then he more or less gave up his profession as a doctor, because I think he felt that he could have been able to cure more of the ills of society in the new position that he was. He didn't see it necessarily as giving up trying to cure people's illness, but he saw it doing it at a more higher level, where he had more authority to deal with many, many issues in influencing government policies as a whole that could have had a bigger impact on the public health in the country, something that was very close to his heart. Everyone in Guyana knew him, and even though he had contacts with thousands of persons, I'm sure that those who he never had contact with would appreciate how much work he did on their behalf, and would also be grieving today, joining his family to grieve his passing. But I believe that we could all be comforted from the fact that he really lived a useful and very purposeful life, and he made an enormous contribution to the development of Guyana, particularly in the post-1992 period. In the pre-1992 period, he did contributed to the fight to bring back democracy. And in the post-92 period, he was a key person in the administration that brought changes in Guyana.